Hello, everyone. My guest today is Dr. Emily Rowe. Emily has been on our show before, and we talked about Lyme disease, and today we're going to talk about POTS, Postural Orthostatic Tachycardia Syndrome. It's an interesting syndrome that is really pretty underdiagnosed at this point in time. There's not a high level of awareness with it. So we get into the actual syndrome itself and then how to treat it, and we discuss some very cool things about cranial nerves and a few other things tangentially, as I always end up discussing with Emily because she has such a vast breadth of knowledge. So please enjoy this wonderful conversation that I have with my good friend and colleague, Dr. Emily Rowe.
Welcome to the Pod of Inquiry. Ready for some thought-provoking cerebral whipping and the destruction of ridiculous medical dogma? Want to shift those stale, moldy old paradigms? Well then, don that thinking cap of yours, get down in the cave, and join our host, Dr. Stephen Barrett, for this week's episode. Let's start spelunking.
All right, welcome to the Pod of Inquiry, everyone. I've got one of my good friends and colleagues, Dr. Emily Rowe, on today, and we're going to talk about POTS. And I think it'll be a fun discussion. I really didn't know much about this until actually you and I chatted a week or two ago. And then when I learned that it had a neuropathic component, I had to kind of dive in on it. So Emily, thanks for coming on the show again. And what do you have to say about this interesting syndrome?
Well, I learned about POTS mostly from chronic infections such as long COVID and Lyme.
Okay.
And but I would say the first patient we diagnosed in our clinic officially with POTS
Right.
was probably in 2017, 2018. And she came into clinic and her
Let me interrupt
Sure.
you real quick so that the audience knows what we're talking about.
Sure.
POTS.
Oh, that's a good
what is-
idea. Let's
yeah, what is?
define it.
Yeah, let's clarify some nomenclature. So tell everybody what POTS is.
Okay, yeah. So POTS stands for Postural Orthostatic Tachycardia Syndrome. And when I've been in the medical field since 1999, and when I was first in the medical field, they often called it neurocardiogenic syndrome.
Okay.
And basically what happens clinically is you stand up and your autonomic nervous system does not maintain your blood pressure appropriately. And if you stand up too quick, you fall, you want to faint. So the clinical definition and the clinical syndrome is defined by at least 6 months of when you go from a supine or sitting position to upright to standing, an increase in heart rate of more than 30 beats per minute within 5 to 10 minutes of quiet standing in the absence of orthostatic hypotension. So that means you stand up and your blood pressure drops. I mean, you stand up and your blood pressure does not drop. It stays the same, but your heart rate goes up. So your heart rate is increasing to help maintain that blood pressure.
Okay.
And the symptoms associated with it is you feel lightheaded, you feel palpitations, you feel like a little shaky. People will say, oh, I feel weak in the knees. They'll complain of visual stuff. Often they go to the eye doctor. There's chronic fatigue associated with it and exercise intolerance. Those are the main symptoms associated with it.
Well, that's interesting that exercise intolerance is a problem because that's one of the recommendations for treatments. And so I think, but they talk about recumbent bikes and, that type. So I kind of understand that a little bit. But before we get into that, this is a bigger problem than I think people realize. It's certainly me because, like I said, I just really kind of,
we briefly
about
chatted about a clinical case, and I was like,
right.
oh, this sounds like POTS.
Right,
and
right.
It's like, I'll send you the active stand test. So the active stand test is, it's a way to check for this clinically if you have a suspicion. I would have my nurse do it usually. I would talk to the patient and I'll be like, oh, do you have an extra 20 minutes? We need to check an active stand test. And
Right.
what the active stand test is you have the patient lay down flat and you set a timer for 10 minutes. So I put them on one of my acupuncture tables in our office. And after 10 minutes, while they're still laying flat, you check the pressure. And then you have them stand. And then you check the blood pressure at 1 minute, 3 minutes, 5 minutes, 10 minutes. And
Right.
you look at both blood pressure and pulse.
Hmm.
I just, put a blood pressure cuff on and hit the button on the machine.
Right.
And what you're looking at is for a 30-point increase in heart rate without a drop in blood pressure. And if you go to the internet, you can Google POTS active stand, like PDF, and you
Right.
can find you can just basically fill in the blanks for the blood pressures. And now the gold standard for actually diagnosing POTS is what's called the tilt table test. And those are done by cardiologists where they actually do them in the hospital and whatnot. And so if somebody takes this test and they're borderline, let's say their heart rate goes up 30 beats per minute. Well, maybe they're really hydrated that day, they've had enough salt, so they're not going to demonstrate the actual definition of POTS, but on a bad day, maybe their heart rate goes up 40 beats a minute. So they
Hmm.
they would. So if somebody's kind of borderline, you can check the active stand test again. You can refer them out for a head-up tilt table test with a cardiologist at a center that does them. And
So,
basically what a tilt table test is, you have the patient flat on a bed and they secure a strap so that the patient is okay. And they actually tilt the table to see if how your blood pressure responds when you're in different positions. Um,
so that let me interrupt you there
sure,
because the active stand test is a relatively simple test that like virtually any provider could do or
definitely.
their medical assistant or whatever,
Mhm.
you know. But is it, I mean, to me, it seems like it's a pretty accurate test.
It's
And
very accurate. I only refer out if people are borderline,
okay,
uh, or some people have to have this gold standard. That's just their personality type.
right, right,
But when I discuss POTS with people, show them the diagnostic criteria, there's a website that's great that's called Standing Up to POTS, that really gets into like tangential issues that are associated with it.
right.
Because really what POTS is, it's a manifestation of dysautonomia, which means that
Right.
the autonomic nervous system is not functioning appropriately.
Which really means the vagus nerve. Something's
Yeah.
going on with the vagus nerve, which is very interesting. Just recently, which that episode will probably have aired
Hmm.
the week before this one, but I had an interview with Dr. Kevin Tracy from the Feinstein Institute up in New York, where they've developed some very interesting technology in vagal nerve stimulation. And in fact, they just received an FDA approval for the vagus nerve stimulator for rheumatoid arthritis,
Oh, that's
which
cool.
is wild because you
Mm.
wouldn't, I never really put it all together like immune system, vagal nerve, and then all of a sudden these guys are able to reduce the cytokines, the specifically TNF alpha and able to suppress that with vagal nerve stimulation. And what was pointed out to me, which I honestly didn't know, um, was that it's really kind of like the homeostatic mechanism for everything, all things internal organs wise, So let's go back to that a little bit. So it's a dysautonomia. Explain what the difference between the autonomic system is
Sure.
versus the
Sure.
sympathetic
The
system.
way I think about it is, your autonomic nervous system is anything your body does automatically.
Right,
So, I eat a hamburger. I don't have to stop and tell my stomach it's time to digest my hamburger.
right,
I don't have to stop and say, if I have to run on the beach, um, I don't have to stop and say, oh, I need to increase my heart rate, increase my cardiac output, I need to increase how much glucose is going to my muscles so that my muscles can get the supply to run. Your body's smarter than any doctor, and it does all of this automatically.
Right.
Things that are automatic are temperature regulation,
Mhm.
blood sugar, blood pressure, hormones, um, digestive function, whether your pupils are dilated or not, reflexes in the body. There's so
Vasodilation.
much that is
Right.
just it's honestly when you really think about like the physiology of what's going on, it's pretty magical.
Yeah.
That and it's constant.
Yeah, I know. I mean, imagine if you had to think about making your heart beat. You know, I
Talk
mean,
about multitasking,
yeah,
right?
it's like,
Um,
wait, hey, I gotta get my heart beating here. I can't talk to you right now, you
right.
know.
No, for sure.
Um, so, doing a little of my research in order to be able to ask you some semi-intelligent questions today, it turns out that it's estimated in the literature that there might be up to 1% of the general population that is affected by this, and it's mostly females, about 80% females, which is very interesting because if you look at a lot of the other neurological diseases like, well, or syndromes like CRPS,
Mhm.
there's a high preponderance from female to male.
Sure.
And yeah,
There's estrogen receptors in the brain and nervous tissue. There's a lot of hormonally mediated the hormones and the endocrine system in general and the neurological system are deeply interwoven. And this is one of the problems is like with conventional medicine is endocrinology is over here and neurology is over here.
right,
And like, what processes your hormones? Well, mostly your liver and gallbladder. So it's really part of digestion as well. And when you really look at systemic biology, it's this gorgeous symphony. But I think there's a lot of overwhelm in the medical system. Uh, Too many patients, not enough time, and a lot of lack of communication between colleagues.
right.
And
Well, you made the point too, which I thought was a very valid point, that it may be a higher incidence of that because a lot of these cases are really running around they're undiagnosed.
I'm sure it's much higher. Now, I understand my perspective is skewed because people often don't come into our clinic until they've seen multiple other healthcare practitioners. So,
Right.
my husband and I specialize in the unique and unusual. But often, part of the problem, Stephen, is clinically, it's very hard to explain for the patient to explain in a history what their symptoms are. So it's
Right.
almost like me going to a mechanic and saying, well, my car's going, making these funny little noises and I feel really silly. I don't have the knowledge about cars to explain what I think is going on. And then the mechanic just looks at me like I'm insane. Um, and this can happen a lot with patients, especially if they're in a short visit. If they're not trained medically, it can be very hard for them to articulate symptoms.
Right.
The first time Chris and I diagnosed POTS was probably 2017, and the patients came into our clinic, and she says, "Well, I keep leaving my body."
Hmm.
And she had been
Okay.
referred to a psychiatrist by her primary care doctor for antipsychotics because they thought she was just,
Having some kind of a schizo.
hallucinating.
Yeah.
And she wasn't. She was really having POTS, and she was experiencing like near syncopal episodes. Let's call it that, near syncopal.
Right.
Um, but her way of articulating it was, "I keep leaving my body."
Right.
Um, and then we ran a POTS test on her, and of course she had mold toxicity, chronic infections, pretty severe chronic histamine responses, inability to eat a lot of foods, the whole mast cell activation picture. And once we got that under control, the POTS got much better. But
So let me ask you this. I mean, I see why it would be hard for people to come and say, yeah, I'm having these weird episodes, because they may not tie it into the blood pressure, tachycardia situation, but they may be going around and saying, yeah, I just faint, you know?
I had one woman, she was like, "Oh, I get low blood sugar. So I
Right.
bought the machine at Walgreens and my blood sugar's normal. But if I eat, I feel better." And then we tested her and because of, and she'll say, "Well, I get these episodes of like sudden onset fatigue." And
Hmm.
it was really POTS. And, if you think about what's going on with POTS, the heart rate and the blood pressure are dysregulated. So you're not oxygenating properly. And when you're
Right.
not oxygenating properly, you're not even cognitively clear because your
Right.
brain consumes so much oxygen.
Yeah, the brain doesn't take it doesn't take a lot of really time for that to affect, so you can get a lot of neurological manifestations. So they may come in and just have these neurological manifestations like I just kind of blank out or I kind of end up staring at the wall or something, almost like a petit mal seizure.
Right.
But it's not because of some kind of epileptic activity in the cortex. It's a
The
situation where
oxygen
it's an
deprivation.
oxygen thing, and the brain, when the brain doesn't get a lot of oxygen, it wants you to fall down so that you lay flat and you can get blood back to the brain.
Exactly.
I mean, isn't that
And
the
it's a
purpose of?
protective mechanism.
Yeah, right. So yeah, so that it's very interesting. So there's obviously some very different, like with any disease, there's going to be mild, moderate, and very severe manifestations of it. And it in the literature that I read, it said that some of these folks are really quite debilitated
Oh,
by
I've
this
had people in
condition.
wheelchairs.
Is that right?
Yes, I
Wow.
had a teenage girl who had long COVID and chronic Babesia and elevated toxic burden. And she was basically in a wheelchair with POTS and missed a year of school. And it was a combination, it was your classic Chinese poo-poo platter, where a little of this, little of that, little of this. And the next thing you know, she was, what pushed her over the edge though was COVID.
Well, that pushed a lot of people over from a neurological
It
aspect
was
for
like
sure.
uh,
Yeah.
what's the saying? The needle the needle that broke the camel's back, right?
Yeah. The
Yeah.
straw.
The straw that broke the camel.
Yeah,
I
right.
knew, I knew.
It was close. You have to,
So silly.
I was going to say you have to suck harder on the needle than the straw, but that would sound bad. I'm going to say that you have to aspirate harder or something, right?
Yeah.
Before we continue with this great discussion, I just want to take a quick break to acknowledge this week's sponsor. I'm constantly exploring new avenues to enhance well-being and address any health concerns. Today, I'm thrilled to introduce you to an exciting supplement called Stem Regen, which I take daily and genuinely believe could revolutionize your health journey as well. Stem Regen stands out as a game changer in the realm of wellness. Crafted from 5 potent plant extracts, it boasts a remarkable ability to stimulate the release of your body's own stem cells from your red bone marrow. Why is this significant? Well, stem cells are the superheroes of our body's natural repair system. They possess the extraordinary capacity to morph into various cell types, aiding in tissue regeneration and repair. As we age, the quantity of circulating stem cells in our system reduces significantly, impairing our body's ability to heal and rejuvenate itself effectively. Stem Regen steps in to counter this decline by kickstarting the release of stem cells into circulation, thereby bolstering your body's innate repair mechanisms. Once unleashed into your bloodstream, these mobilized stem cells actively seek out areas of damage or injury, initiating the healing process. By incorporating Stem Regen into your daily routine, you're essentially empowering your body to tap into its own regenerative prowess more efficiently. I firmly believe that Stem Regen could be a valuable addition to your wellness regimen, especially if you're seeking to fortify overall health and vitality, accelerate tissue repair, or expedite recovery from injury or illness. This first of its kind stem cell mobilizer is changing the game in regenerative medicine. Don't wait to unleash your body's innate healing capabilities. Visit stemregen.co/Dr. Steven, that's with a PH, and use the code SBPOD to get a 15% discount off your first order of Stem Regen. But yeah, so then Are there any genetic predispositions to this? Because it seems like there's some different subcategories where they talk about phenotypic
Yeah,
expression,
there
but
probably are, and I think there's needs to be more research done. I do
yeah.
see a crossover between POTS and Ehlers-Danlos and hypermobility. And even
Hmm.
with Ehlers-Danlos and hypermobility, there's all these different subtypes. And I do suspect this is where you have genetic predisposition and then environmental triggers.
Right.
And that, it's multifactorial. If you think about collagen,
Hmm.
your vascular system is made of collagen.
Right.
And, one of the things we know is that COVID is a bad trigger for POTS.
Okay.
And I see that with both COVID infections and COVID vaccinations. I see people develop after vaccines.
Right.
Um, but part of what happens is you get what's called endothelial dysfunction. And what endothelial dysfunction is, the inner lining of the vessel has especially the arteries has a smooth muscle wall.
Right.
It's supposed to vasodilate and vasoconstrict, it's
Right.
changes size, and that's part of the autonomic nervous system. It's also related to collagen. If you think about the
Hmm.
what your vessels are made of is
Right.
collagen, and there is an association of EDS with your collagen's way too stretchy. And this is where you look at things like Marfan syndrome and increased rates of aneurysms, but you don't necessarily have to have the full-blown Marfans to have Ehlers-Danlos syndrome and dysfunction of collagen. You can have a much milder version. So I do see genetic predisposition to it. Often I think with dysautonomia, there's a trigger. And often the trigger can be a toxin, an infection, any situation where your life feels threatened. So, if somebody experiences an unexpected violent situation, um, then what can happen is it can trigger dysautonomia because you stop regulating the balance between the sympathetic and the parasympathetic. And so anytime your body feels threatened, so I had one patient have a severe pneumonia and ended up with like a pulse ox in the 80s and had to
Mm.
go into the ICU on pressors because she literally got septic. And after that incident, she developed dysautonomia. And it can happen anytime your actual body, even if it's not emotional, feels like, oh my gosh, I might die.
Yeah. So let me ask you this, because I've heard of some cases where actually they can be triggered by not just standing up, going from a sitting or a supine to a standing position, but people can actually be just sitting there and have some kind of weird stimulus, like maybe bright flashing lights or some other, thing that will give them a syncopal event, even though like maybe it's just too hot in the room for some
Sure.
folks, or they're stressed. Just
Yeah.
there's a lot of, adrenergic activity that can play into this as well, from what I've read. So I think it's a very interesting syndrome because there's more of it than we thought, and it affects people differently from what I've read, that some people, like you say, they can feel like a brain fog, or
Sure.
some will just pass out. I mean, it's just kind of an interesting um,
There's a brilliant
syndrome.
book by Stanley Rosen about the vagus nerve. And he's a body worker who has lived in Europe for years. And basically, he developed a series of exercises for the cranial nerves. And he goes through all of the cranial nerves in his book. And basically, and it's so simple and so brilliant. But he basically says if you look at the cranial nerves, and most medical professionals learn them in school. So you have
Right.
cranial nerve one, neural factory nerve. You have cranial nerves associated with vision. You have
Right.
cranial nerves associated with hearing. You have cranial nerves associated with taste and smell. But then all of the cranial nerves are also associated with social interaction. And the vagus nerve is cranial nerve 10. And what the
Hmm.
cranial nerves are, just for a friendly review, they're nerves that directly come out of the brain and innervate structures in the head and the face. And they're all involved with one thing. One is how to survive. So how to see food, how to smell food, how to taste food, how to get it in your into your mouth and swallow, how to hear for possible predators, how to
Right.
hear for possible food, but they're also involved with social interaction. So there's part of normal society is to have eye contact, um, to have a conversation and hear. And what can happen with this is I will see cranial nerves affected. There might be like a very mild cranial nerve palsy. There'll be slight drooping of the face, and it kind of indicates other dysautonomia. And one of the things that, Stanley Porges' work with polyvagal theory is that in order to reset the vagus nerve, what you really need is a sense of safety and community and feeling safe with human interaction. And that's what allows us to modulate the vagus nerve.
Yeah, and the interesting thing about the vagus nerve, and you, that's a great summary about the cranial nerves. But there's a tremendous amount of crossover between them. For example, the vagus nerve has, you can stimulate it with periauricular or around the ear,
Mhm.
in the symbicontia, and that's probably also stimulating maybe some branches of the trigeminal nerve, maybe other nerves as well. So I think we like to think of things in very discrete anatomical, maps, like this highway is here and this highway is there, but that's not the way it works in the nervous system, is that there's a lot of crossover between these, and that one can feed off of the other. Um, so it's
Yeah,
kind of
and
interesting to.
they're bidirectional too.
Right,
Used to think
right.
that it was all, signals coming from your brain down, but cranial nerve 11 innervates the trapezius and the SCM, so which is the muscles at the
Sternocleidomastoid.
top here.
Right.
And I've seen people get severe shoulder tension and neck pain that'll trigger a migraine, and
Hmm.
it's the opposite signal going the other way. So, and it's all mediated via cranial nerve 11. And, but I think you're right. It's not just, it's a network, not necessarily like on and off a highway. Um,
Yeah, and then the other thing that I didn't know until Dr. Tracy sent me his book, and then I had an episode just recently with him, that 80% of the fibers in the vagus nerves, because there's one on the right, one on the left, but 80% of those fibers are afferents, meaning they're sensory. They're taking all of the
right,
information to the brain, and only 20% are going out to do the deal,
right.
which is shocking. You would think it'd be almost the other way, but I think that ties into what you said about the importance of the cranial nerves, is that you're trying to figure out what's going on around you.
Mhm.
And without all that big data, so to speak, you couldn't do it.
Right. And even, I remember my first job in the medical field in 1999. I was an EKG tech at the hospital before I went to medical school. And I also worked telemetry. I took a class in how to read EKGs, and they would let me work the telemetry, and I would watch the monitors, and anything abnormal, we would call the cardiologist. Well, there was this one old cardiologist, and nobody else would do this, but he would, if somebody went into an irregular rhythm, he would massage the neck. He would find the baroreceptors,
Hmm.
massage the neck, and you could watch the telemetry monitor go back into a normal rhythm. And other doctors were very trepidatious to do it because they were like, oh, what if you rub the wrong way? You could potentially stimulate VTAC, and it's not really something that's done anymore. But it was fascinating for me to see because, and so there's receptors in your carotid that measure what your blood pressure is,
Right.
and it sends a signal through the vagus back to your nerve to help modulate, the afferent efferent highways of the vagus nerve and
Right.
help modulate like what your cardiac output is. So it's so interesting to think about. And I have seen chronic lymphadenopathy and Bartonella affect these kind of things. People who have had head and neck surgeries, all sorts of other scar tissue in there.
Right.
I've even seen, trigeminal neuralgia be an aspect that's tied into this. And every clinical situation is unique. So there's just layers to it.
So there's some compelling, I don't know, I think it's compelling anyhow, literature that talks about non-invasive vagal nerve stimulation.
Mhm.
And the premise is that, usually in the biohacking world, everybody talks about, well, I want to do something to stimulate my vagus nerve so that I am more parasympathetic. I can improve my heart rate or increase my heart rate variability, kind of get into that chill zone rather than in the stress zone, the the parasympathetic versus the sympathetic balance. Do you think that there would be any role for vagal nerve stimulation in patients or for patients that have POTS?
So I actually have used vagal nerve stimulation for myself. I actually have a device. It's funny. It's sitting right here. And
You
I
got to
don't work
tell
for
me
this
about it.
company. I don't sell it. It's called
Okay.
GammaCore.
What's it
It's
called?
GammaCore.
Okay.
It's
Got it.
actually FDA approved to treat headaches. I was
Okay.
used to treat migraines, and it's actually um, an external stimulator. And you basically put it on the neck at an angle like this with a little bit of electrode paste, and you stimulate it on low, and
Right.
it helps to reset the vagus nerve. I've seen it help digestive function, which
Mm-hmm.
makes sense with the vagus nerve.
Right.
I've seen
Right.
it help headaches. I have seen it help stress and trauma, um, and basically any type of dysautonomia. However, I have seen if you don't, how do I say this? I've also seen it trigger people in a bad way.
Okay.
And this has just been my clinical experience. So
Right.
I had one patient, her neck was very tight. We put it on. She wasn't really feeling the stimulation. We increased the stimulation and it triggered a muscle spasm, which they tell you it can. And the
Right.
muscle spasm triggered a bad headache, and she was doing it because she had headaches. And so there's kind of this sweet spot where if you're on the edge or flight or fight, I've seen it actually trigger in the wrong way.
Well, it's interesting because, I'm talking a lot about vagal nerve stimulation just because I went through the learning process for
Mhm.
that with Dr. Tracy's episode. But when they're putting an implantable vagal nerve stimulator, it may only run 1 minute in a day. And,
So
and,
this,
and it's a
this, yeah,
low, yeah,
yeah,
and
it's
it's like
low.
it's a really low
Mhm.
amperage. I mean, it's not like you're really hitting and jolting this thing. I
No,
mean,
no,
it's
no.
it's 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 a pretty very subdued stimulation. But
Yeah, so
so
this
go ahead.
external device you use, so you hit a button and it runs for 2 minutes, and you're supposed to do 2 minutes twice in the
Okay.
morning,
Okay.
2 minutes twice at night, and that's supposed to be prophylactic for migraine.
Interesting.
If you're like, oh, I feel an aura, I feel the prodrome to a migraine coming on, I'm sleep deprived, or, I had to skip caffeine for a test this morning, whatever your triggers are for migraines, you
Right.
can you can whip it out and do it right away. You can also whip it out if you're actually in crisis mode. But it's short as well, you know.
Right. Right.
And this
Well,
device is actually approved for cluster headaches, FDA approved for cluster headaches, migraines, and oh, what are they? There's a word for like headaches of unknown etiology. There's an actual
idiopathic headaches.
no, there's an actual like ICD that's special. I can't remember what it is.
I can't, I'm blanking on it. I know what you're
Yeah.
talking about,
But
yeah.
yeah, but this device though, you actually need a healthcare practitioner prescription.
Right.
And then you get just like you would go to Walgreens or CVS and pick up a medication, you
Right.
can get the device then from the company once the prescription is written. And there are other vagus nerve stimulators that I looked at, but I haven't tried. But there's one where you wear it on your head and you have to wear it an hour a day, and then they tell you not to drive afterwards. And this one
I think
just,
that is that cephaly, maybe?
I think that's it.
Yeah,
There's a variety of them.
yeah,
And I think, this technology is pretty cool. It's still
right.
relatively new. I'm sure in the next 10 years, the devices are going to get better and less invasive and, all that kind of stuff. But like you said, even the implantable device, it goes off for a very short period of time and with
Right.
a low amount.
Right. Well, they even did some experiments with Wim Hof. I know you know who Wim Hof is, right?
The breathing. Yeah.
Yeah. So, I mean, I don't know how many Guinness World Records that guy holds for being underneath frozen lakes and whatnot, but he's kind of a freak of nature. But they actually drew blood on him to look at his cytokines, and then he went into like a 2 hour breathing session, which probably only he can do. And then
Mhm.
they drew his blood again, and he was able to reduce his cytokines by about 70%. And now, a message from our sponsor. I've been taking Nature's Marvels bioregulatory peptides for more than 3 years now on a very consistent basis. It's an integral part into my wellness journey, and I can't imagine not even going on this journey without that. These are designed with cutting-edge science to optimize and restore your body's natural processes. After 3 years, I can say without a doubt, this isn't another wellness product that just gets pushed to the back of the cabinet. This is the real deal for human optimization and longevity. Start your journey today with Nature's Marvels. Our website's below,
That's
which is
fascinating.
it's very fascinating. So there's definitely some vagal play coming into that with the breathing and whatnot. And I think one of the treatments, believe it or not, that I came across for POTS was cold immersion,
I
which
mean,
is I
whenever you're
don't know.
dealing with that, I think you're affecting autonomic nervous system because of the temperature regulation component.
Yeah, yeah.
And
So
it's very interesting. I haven't read any of that data, but that's fascinating to me. But it
yeah, and
makes,
I don't have any data,
mm,
other than saying, yeah, this was one of the things that I picked up as a possible treatment in my looking at this, but I don't have any data where they've done a clinical study on that or anything like that. But you would think that it would play a role, though, because 30 seconds to 3 minutes in a cold tank makes your body do a lot of different things.
mm.
So, I don't know. But what about pharmacological management? Is there anything that can be done from that standpoint for these folks that are suffering from POTS?
So, I am a minimalist when it comes to medication. I do love meds. I think there's a place for them. I'm not
Right,
against it at all.
right,
The standard treatment is a medication called midodrine. Um, and usually if you go to a cardiologist, they'll give you a much larger dose than what Chris or I would give you. They'll usually start at 10 milligrams. But I found that people do really well at 2.5 milligrams 3 times a day and then titrate up as needed. One problem with midodrine is you have to check that they don't develop hypertension
right,
because it basically causes vasoconstriction. I have seen people not do well with it who have migraines because then
right.
all of a
Because,
sudden
right, makes
that
sense.
whole vasodilation, vasoconstriction issue.
Right.
Some doctors will give you a beta blocker uh,
Mm-hmm.
because part of the issue is the heart rate's going up and there
Right,
is associated anxiety. But, what I usually like to do is try to explore root cause um,
right,
and treat in the meantime with medication or and supplements. One thing that helps a bunch is salt supplementation. And we're always told, oh,
mm-hmm.
salt's bad for you. For certain people, they need salt.
Right,
And salt and hydration are very important in POTS. Um, Getting enough sleep uh, is extremely important. Sleep deprivation is a bad trigger for dysautonomia. And regular meals. Some people do great with intermittent fasting. I've found that POTS patients need small, frequent meals because dysregulation of blood sugar is part of dysautonomia, and dropping blood pressure, I mean,
right,
dropping blood sugar can trigger a POTS near syncopal episode.
right, right.
So
That makes
all of
sense.
lifestyle management things are very important. In terms of root cause, I've found that, and this is my clinical suspicion. I suspect that there's probably an autoimmune neurological component, and maybe we
Hmm.
don't even know what the antibodies are.
Right. Well, I think one of the things that is so powerful about what you and your husband are doing down there at your clinic, and I've been fortunate enough to come down and see what you're doing, and you guys ran some really eloquent and very sophisticated tests on me, but you don't look at these things as individual things. You look at these as an individual component of this person's a human, and they've got all of this other human physiology going on. And so when you look at all of that, you say, oh yeah, okay, you got a little bit of mold, or you've got, reactivation of Epstein-Barr, or who knows what
Right.
that you guys are really looking for, rather than just saying, okay, one syndrome, one drug, So that's why I take my hat off to what you guys are doing, because you are actually you're making the overall machine better, not just changing out one little part.
Oh, and that's the beauty of it. A lot of times a patient will come in with about 30 symptoms, and I will kind of mentally make, of course, I always make a differential diagnosis and, a list of, what needs to be assessed.
Right.
And basically what shows up on the assessment is usually you prioritize two or three things. And often what I find it is if people are already having a really good lifestyle, like they're eating well, they're exercising, they're sleeping, they're managing stress, but they're still, and they're still really sick. Often it's there's some sort of chronic infection
Hmm.
or elevated toxic burden.
Right.
And there are we what I usually start with is heavy metals and mold in terms of elevated toxic burden. There are some super fancy tests where you can look at things like atrazine, you can look at
Glyphosate.
bisphenol A,
Yeah.
glyphosate, all that stuff. And I do those tests on certain patients.
Right.
Um, I also love looking at the genetics of detoxification. I think it's fascinating. And so that you can individually support. And we're all unique. For example, my husband and I both had mercury exposures. He got mercury out very easily, and I did not. And when I looked at my genetics, I have impairment in a lot of the pathways that are used for mercury detox. But the
Mhm.
funny thing is, I can metabolize caffeine quite easily. I'll have an espresso at 10 o'clock at night, fall asleep. My husband
Yeah.
has coffee afternoon. He's up all night. He can't even do a B12 shot after 6. Um,
Right.
and so I can metabolize caffeine and he can't. And so, we're all unique individuals. And depending on what you've been exposed to and your genetic predisposition, it's very different.
Right.
Uh, so, it's endlessly fascinating.
Right.
Yeah. And then I do think that uh, certain infections are chronic viral is what I often see associated with POTS. I see a lot of chronic cytomegalovirus. I
Hmm.
see a lot of long COVID, Epstein-Barr, and then I'm seeing a lot of Coxsackie trigger this, which Coxsackie is known as hand, foot, and mouth disease in
Right.
layman's terms. And we're taught that, oh, little kids get the rash on their hands and their feet. With adults, it's not a problem. But I have seen all sorts of weird, almost like pericarditis that's subclinical from it.
Hmm.
And Coxsackie is associated with pericarditis, just like COVID can be. And I've seen POTS with it. And these days I'm having trouble getting Coxsackie tests from Quest and LabCorp. So I'm sending labs off to Germany for Coxsackie these days.
Wow.
Um, I know.
So,
Yeah,
yeah.
our healthcare system is it's changing, that's for sure. It's a little crazy.
So let me ask you one last question.
Sure.
You guys are doing some fantastic stuff down there at the
Mhm.
clinic, and I think that the whole thing, and I love the way you guys are practicing medicine, because that's really the way it needs to be practiced. Mainstream medicine now has totally lost its way. There's no way you can go into a physician's office that are seeing 70 patients in a day and have any level of care, no matter how expert they are. And you guys have figured out that that's not the way to go. You look at the patient, from a holistic standpoint. I know that word gets used way too much, but I mean, if you think about what a lot of times people are doing, is they're not really treating the whole problem. They're just substituting a small little thing to cover up one symptom of many, maybe. But you all are trying to get the core of the human being done, upregulate the whole physiology of that person, so that all of these other little things will sometimes they'll just go away because you've taken it out. So my last question, well, two questions, I guess. When you go on, then you figure out that there's another question. One question is I want you to tell everybody how to get down and see y'all. But then the question I was going to ask before that was, what about gut microbiome? I mean, because it seems to be jacked up in everybody. And that's a thing where, hell, it can be good this week and next week it's all whacked out.
Yeah, and well, one of the things what I include in infection is parasites, gut microbiome,
Right.
colonization with candidiasis, aspergillus, um, parasites. I see a lot of amoebas, and sometimes you just have a clinical suspicion of parasites. You run a
Right.
DNA stool analysis and nothing shows up, but then you give people parasite treatments and boom,
They get
gut
better.
health really improves.
Yeah.
Um, you know, there's studies that show that glyphosate um, affects intestinal permeability, which is the inner lining of the gut. And
Right.
when the inner lining of the gut is disrupted, just imagine like you're
Everything
walking on a
comes in.
sidewalk and everything's smooth, or are there a bunch of cracks in the sidewalk? And now, you
Right.
get all these antigens coming through, food particles, bacteria triggering you. The interesting thing about glyphosate too is if you look at the structure, it's very similar to glycine, which is an amino acid.
Mm,
And I have a clinical suspicion that it actually deposits in collagen. And collagen, you need your branched chain amino acids, which
right.
is and there is a very interesting book by an acupuncturist called The Devil in the Garlic, which is all about things like SIBO, garlic,
Hmm.
and onions and triggering SIBO, but also about glyphosate and how it affects fascia, which is
Right.
fascinating. Fascia is what holds us together, and it's around all of our internal organs, like our liver, our intestines, our gallbladder. And I think there's a ton of fascial dysfunction from elevated toxic burden. That's things like pesticides. We have antibiotics in our food.
Right.
And I some of my sickest patients are vegan, and I do see that animal protein is important for health. And I was a vegetarian for many years, and my health did not improve until I changed my diet. But I think factory farming is terrible.
Hmm.
Um, I think
Right.
when the animals are constantly fed antibiotics, you're getting it in there, and then
Yeah.
there's molecules of emotions, and when animals are stressed and in fear, you're probably eating those molecules, and those are real.
No, they're very definitely real. I mean,
Um,
if you think about it, Emily, it's amazing that we're still able to walk around on this planet because we're swimming in this milieu of just bullshit that
well,
they're
I
jamming down. They're between not only the glyphosate, but I mean, every corner you take, big ag is playing with different things. And I read something the other day. It kind of gives me a rant, but there's like 41 or 42 different like not good chemicals in a Chick-fil-A sandwich. It's like they're having to put all these preservatives in order to maintain it so that it doesn't go bad while it's going from store to store or whatever. It's like, and I don't mean to beat up on
no,
Chick-fil-A,
and but
you
that's
know.
the and those are the kind of foods that are on kids' menus. That's what children
Yes, right.
they
Oh,
actually
it's
have. friend who's an acupuncturist in the UK, and she'll try to get the parents to change the kids' diet, and the parents won't change it. So what she does is she makes the parents eat the same food as the kids for 2 weeks.
Oh.
And after 2 weeks, the parents are like, I couldn't stand it. I had to have some broccoli because they've
Yeah.
been eating chicken McNuggets and yogurt with sprinkles.
Wow. Yeah. Great. Get your load of food dyes in.
Yeah, no.
Right.
And then and then they realize how toxic it is for,
Right.
you know. And it's difficult with kids,
Right.
es-
Well, I
especially.
mean, look at a hospital. Look at the stuff that they give the poor patients in the hospital, for God's sakes. They do all of these incredible things, and then the breakfast comes in and it's like some pancakes and syrup and orange juice that's not even orange juice, some flavored stuff, and then Jello or applesauce. It's like, you got to be kidding me. I mean, it's like you're doing all this stuff, but you're killing us at the same time.
So
It's
Stephen, I had metastatic thyroid cancer in 2017 and I needed to have surgery. So I had my thyroid removed. And after the surgery, I have celiac. So I said I can't eat gluten, I have celiac. They didn't have anything they could feed me at the hospital.
wow.
The doctors said that they had like a diabetic diet, they had a low salt diet. They didn't have an option to
Right.
accommodate me as a
Right.
celiac. So I had lovely friends who brought me some very healthy food, and they wouldn't let me go till I ate, and they kept trying to get me to eat a sandwich.
Yeah. Oh, it's wild. It's
And
wild.
I
So
don't think anybody was malintended. They
no,
were deer in
but
headlights when I told them. They had no
yeah.
idea what it was.
Well, I think that there's so many people that are just sleepwalking, and that includes a lot of physicians that like they're just doing their deal. It's like, yeah, whatever. I'm just going to eat that burger today, or whatever. But
So
anyway,
there was a study that came out. I want to say it was 2023. I'll find it and I'll send it to you because you can even,
okay.
can you link studies to the podcast?
Yeah, I can link
Yeah,
it in the show
so it was
notes. Sure.
fascinating because
Yeah.
I have empathy for doctors in the conventional system because I was one of them. They did a study of the average primary care doctor, and they said if they followed guidelines for the number of patients they carried, they would need 25.8 hours per day in clinic.
Yeah. Right.
There's no way that anybody can do a good job.
Well, and then, all right, this is another rant, but look at the guidelines, for God's sake. Like the
And that's
American.
that's the
Yeah,
guidelines, which are
right.
terrible, right?
Right.
That's not
Like,
even
yeah.
like looking at root
Right.
cause. That's just
Right. Yeah.
things like, oh, you're due for your colonoscopy, you're due for your mammogram, you're due for, let's do a CBC and a TSH. Super like basic primary care guidelines.
Right.
Um, so how sad is that?
No, it's very sad. It's
I
very
can't
sad.
even imagine the overwhelm of working in a system like that. And,
Yeah.
I left many years ago. I left regular medicine in 2005. So I can't even imagine what that's like.
No, no. All right, Emily, I got to wrap this up. How do folks find you?
So my husband and I are licensed in Florida. So you have to come into our office in person in Florida for me to see you. My license does not extend to other states, but you can find us at Miami Beach CWC. That's Comprehensive Wellness Center.com. So that's
Okay.
Miami Beach CWC.com. And if you go on our website, you can call us. A real live person answers the phone. We don't have an answering machine. We have a HIPAA compliant texting line, so you can look up that number on our website. It's very easy to find us.
Awesome. Well, I love talking to you. I always learn so much and I always get energized. And so thanks so much for taking the time and coming on tonight.
Oh, it's always an honor to chat with you about this stuff. And I think this is it's good to raise awareness about this because yeah, there's often a crossover with unusual neurological symptoms with POTS.
Right. Right. Thanks so much, Emily. One of our main sponsors, Approved Medical Solutions, is running a 5-day cost-free study on the effects of their product Clean Ketones for essential tremors. This is going to be a very beneficial application for this product, and they have demonstrated to me that it not only improves my athletic performance by at least 10%, it also helps with clarity and concentration. So if you'd like to enroll somebody that you know into this study, just see the link below, and they will welcome you in to try this great product. I hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes found at our website, podofinquiry.com. If you think you might have tickled just a few neurons inside that cerebral cortex, please spread the word to your friends and colleagues and tell them that they need to get spelunking. Also, if you can take a minute to leave a review on your podcast provider of choice, and especially Apple Podcasts, that would greatly help the show and be so appreciated, provided it's positive. And if not, then just keep your pie hole shut and stay down in that cave. Let's keep spelunking.
This podcast is designed for informational purposes only and does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find us a welcome goblet to sip from, or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the Pod of Inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The Pod of Inquiry disclaims any responsibility from anything taken from the show and used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.